Cartwright.
Thank you, Mr. Chairman. I echo everything the chairman just said about an all-government approach. We have to engage in all-out war on this heinous problem that's infecting our nation. And I thank you for your efforts in taking on that war. In fact, in my own congressional district in 2020, under your tenure, the FBI assisted in the arrest and prosecution of a man who was caught selling fentanyl that resulted in a fatal overdose in northeastern Pennsylvania. We understand that, and it's something that goes all over the country. Well, Director Wray, you got a question earlier about political appointees and political agendas at the FBI. Just to make it very crystal clear, how many political appointees are there at the FBI?
One.
And that would be you.
Yes, I don't think of myself as a political appointee, but I guess technically I am the one political appointee since I was nominated by President Trump and confirmed by the Senate.
In fact, what was the name of the president who nominated you to be the Assistant Attorney General for the DOJ's Criminal Division in 2003?
President George W. Bush.
And what president nominated you to be the director of the FBI?
President Donald Trump.
Okay. Well, one thing that you didn't get to in your testimony, you gave us a very fulsome written statement before that couldn't possibly be read in 5 minutes. But one thing you didn't get to in great detail was the Hive ransomware. You mentioned there's all kinds of varieties of ransomware. But in January 2023, the DOJ and the FBI announced the success of an FBI investigation against Hive ransomware. Tell us about that.
So the Hive ransomware takedown was a very significant operation for a number of reasons. First, I should say the Hive ransomware hit victims all over the country and to some extent all over the world, and many of the victims were in particular in the healthcare sector, which to me is a particularly pernicious type of ransomware because you're talking about putting not just hospitals or other types of healthcare facilities' finances at risk, but you're talking about putting patient care at risk with ransomware attacks. But the reason the Hive takedown was so important is that we were able to essentially hack the hackers and get into their infrastructure. And while they didn't realize it, we were, every time there was a new decryption key available in their infrastructure, we could essentially take it and then make it available to the victims, which then meant that the ransomware victims to the tune of, I think, something like 1,300 victims. These are all organizations, hospitals, medical clinics, specialty clinics.
Didn't have to pay the ransom.
They didn't have to pay the ransom. In some cases, they had already paid the ransom, and we were able to unlock it. But other cases, we were able to get them the key so they didn't have to pay it, and I think ended up saving these healthcare institutions something like $130 million. And some of these are small clinics too. I mean, we had one I can remember where we had a FBI case agent and computer scientist raced out. The clinic was so small that the doctor was also the guy that ran the IT for the clinic. And so we were able to help them. So
well, this is a very scary problem for American businesses and hospitals and all sorts of entities that rely on computers. We all rely on computers. So the FBI was able to step in and interrupt them being held for ransom, saved $130 million in ransoms being paid. But the problem is not enough businesses report being stuck up for ransom because of ransomware. Something like 70–75% of businesses don't report it. Why is that? And what can we do about that?
Well, I guess the good news is that more and more businesses are reporting because they're starting to realize why it makes sense for them to do that. But it is true that Hive helped expose that an awful lot of victims were not reporting. And I think in some cases it's that the organization that's been targeted, whether it's a hospital, a business, what have you, is worried about reputational harm or something like that, or because they're worried they're going to be in trouble for paying the ransom. And what we say is, look, while we discourage paying the ransom, we understand it's a hard decision, and what's most important is that you contact us as soon as you get hit. And I like to use the analogy we've all seen on the movies, different kind of ransom, like a kidnapping, right? You've all seen those scenes where the parents and the kid's been kidnapped, and they're trying to figure out whether to pay the ransom, and they're on the phone with the kidnapper, and you got the FBI agent there with the headset on and so forth. This is the cyber equivalent of that. We want the company, the hospital, the school, whatever it is that's been hit, whether they're going to pay the ransom or not, to contact the local FBI field office, because there are things we can do in Congressman Clyde's home state of Georgia, and my home state as well, with Colonial Pipeline. We were able to, because Colonial did the right thing and reached out to us early, we were able to work with Colonial and essentially claw back a big chunk of the ransom before it got to the bad guys and get it back to Colonial. And that's we can't do that in every case, but that's the kind of thing that that we can do if we're contacted early. And of course, the irony is that a couple of weeks after we did that with Colonial, and again, they really were stand up and were smart about how they handled it. There was another company that had quietly paid the ransom somewhere, and that essentially called us up and said, "Hey, we understand you can maybe get our money back." That's really not how it works. And we'd like to be able to help that other company, but once they've paid, time is of the essence, and it kind of, it's paid in cryptocurrency, and it scatters quickly. So if we're going to follow the money and disrupt the attack, we need to be contacted quickly.
My time is up, but the moral of the story is contact the FBI.
Yes, sir.